Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 19th topic. Bruxism. 19. Bruxism. Contents. 1. What is bruxism? 2. Causes of bruxism. 3. Bruxism and occlusal interference. 4. Occlusal analysis of bruxism. 5. Occlusal treatment for bruxism. 6. Goals of occlusal treatment for bruxism. A. Stabilization of the articulating position. B. Elimination of occlusal interference in the centric relation. C. Elimination of occlusal interference in eccentric relation. 7. Treatment of bruxism using splints. 19. Bruxism. 1. What is bruxism? An oral habit consisting of involuntary rhythmic or spasmodic non-functional gnashing, grinding or clenching or teeth, in other than chewing movements of the mandible, which may lead to occlusal trauma. 2. Causes of bruxism. Various studies have been reported on the causes of bruxism. In the past, many researchers asserted that there is a relationship between bruxism and psychological stress. However, Dawson argued that it is problematic to attribute most causes of bruxism to psychological stress. Currently, most bruxism is considered to be caused by malocclusion. Ramfjord and Ash demonstrated using electromyography that eliminating early contacts reduces clenching frequency and decreases muscle activity levels during clenching. Furthermore, Ramfjord reported that some form of occlusal interference exists in all patients with bruxism. Dawson demonstrated that bruxism is a defensive reaction to occlusal interference. That is, bruxism is the act of rubbing teeth together to resolve occlusal interference. However, since the area where teeth are rubbed together often differs from the site of the occlusal interference, bruxism continues to worsen, causing various disorders in the temporomandibular joint and masticatory muscles. 3. Bruxism and occlusal interference. Dawson discusses bruxism over 10 pages in Chapter 28 of Functional Occlusion. At the beginning of that chapter, Dawson states, regardless of the cause, the most effective treatment for bruxism is to perfect the occlusion. Dawson reported that by carefully eliminating all occlusal interferences, he was able to completely eliminate the clinical symptoms of teeth grinding in most patients. This observation demonstrates the deep relationship between bruxism and occlusal interferences. 4. Occlusal analysis of bruxism. Occlusal analysis for bruxism is performed using diagnostic models mounted on a semi-adjustable articulator in the centric relation position. This is because patients with bruxism tend to perform occlusal movements that avoid eccentric positions where occlusal interference occurs. Consequently, it is often difficult to induce the jaw position that causes occlusal interference, making accurate occlusal analysis challenging with an intraoral examination alone. 5. Occlusal treatment for bruxism. When bruxism is confirmed in a patient, occlusal analysis and diagnosis are performed, and occlusal interference is eliminated. Even when the patient's bruxism is caused by psychological stress, eliminating occlusal interference is necessary to confirm this. Eliminating occlusal interference carries no side effects and is expected to yield significant therapeutic effects. Occlusal treatment for bruxism is performed to achieve the following three goals. A. Stabilization of the occlusal contact position. B. Elimination of occlusal interference in the centric relation. C. Elimination of occlusal interference in the eccentric relation. Each will be explained below. 6. Goals of occlusal treatment for bruxism. A. Stabilization of the articulating position. The upper right photograph shows only 3 teeth in occlusal contact at the cusp tooth contact position. By adjusting the occlusion of those 3 teeth, all teeth except the lower left fourth molar can now achieve stable contact, as shown in the lower right photograph. In other words, at the cusp tooth contact position, providing as many stable occlusal contact points as possible allows for load distribution. B. Elimination of occlusal interference in the centric relation. Even minimal occlusal interference at centric relation can trigger non-functional activity of the lateral pterygoid muscles and cause non-coordinated hypertonicity in the closing muscles. Therefore, occlusal interference at centric relation must be eliminated with high precision. C. Elimination of occlusal interference in the eccentric relation. The removal of occlusal interference in the eccentric position aims to achieve smooth anterior tooth guidance and the prompt separation of all posterior teeth. 7. Treatment of bruxism using splints. Occlusal splints may be used in the treatment of bruxism. There are different types of occlusal splints depending on their purpose. When the goal is temporary symptom relief, a splint fitted over the front teeth is selected, as shown in the upper right illustration. When the goal is to heal temporomandibular joint complex disorders, a splint covering the entire dentition is selected, as shown in the lower right illustration. If the splint is removed after symptoms of bruxism improve, the symptoms will recur because the occlusal interference has not been resolved. Therefore, after removing the splint, occlusal analysis and diagnosis are necessary, and the removal of occlusal interference is required. Standard occlusion theory for TMD. 19. Bruxism is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 20 noises of TMJ.